Okay, I'm here now. I'm talking to Nick Tregoning, who's the political lead for Healthy Cities here in Swansea, and I just wanted to ask you, Nick, a couple of questions about the Healthy Cities initiative. And the first question, I guess, is just the general one. What does it actually mean to be a healthy city?
It's almost easier to say what it doesn't mean. What it doesn't mean is that the city has reached a particular health status. What it does mean is it's a city which is working towards putting in place some processes which will enable the reduction of health inequity in the city, so that people's the kind of gradient in health that we see, and things like life expectancy and so on, is reduced in the city as a whole.
And what would you say are the advantages then of being a healthy city? What's the benefit for us in getting involved in this?
Well, because it's something which is Europe-wide, I mean, we're part of a movement now which the WHO, the World Health Organization, have across Europe. There are something like 80 cities who are involved. You get the opportunity to, if you like, learn from other people's experience and see what other initiatives are happening elsewhere and put those kind of things into place. I mean, we know a lot of the things that would actually help to improve the health status of people in Swansea, and that's the same across Europe in many ways. What we don't do is to do them very well. And Healthy Cities is about promoting a process whereby partners, including the council, including the health board, including the public sector and the private sector and the voluntary sector, work together in order to be able to improve the health of Swansea.
And are there sort of other examples from other countries that you've looked at already?
Oh, absolutely. I mean, you can pick some, and thinking off the top of my head, if you look at Helsingborg, for instance, where there's some very interesting works being done with urban planning. Kuopio in Finland, where again there's been a substantial amount of urban planning done, because the environment and things like transport and things like housing have far greater impact on health outcomes for people than simply whether you can get the right drugs for your chest infection or whatever it is. And in the last 20 years, it's the case, isn't it, that it's non-communicable disease, things like diabetes, heart attack, obesity, all those kind of things. They're the growth areas in Europe. It's not infectious disease. And if we're going to do something about health inequity, then we do something together as a community, not just the public sector, but as a community, in order to bear down upon that. Otherwise, if we don't do that, we will end up in the situation where here in Swansea, the same areas are showing the same kind of health deprivation in 60 years' time as they've shown for the last 30 years. And like a lot of other people, I've had enough. We have to do something about it.
Okay, and one of the things that some people might be thinking is that, okay, this all sounds very good. We've got a health, social care and wellbeing strategy, and that the Health Trust will have all their service delivery plans and so on. Why do we need this extra initiative? Why do we need Healthy Cities on top of those other things that we've already got?
I'll tell you why I think it is, because it allows you to have an overarching umbrella and an overarching idea within the city whereby you can set common goals together and then work together in order to be able to achieve those goals over a finite period of time. And you can deploy your resources together in order to be able to do that. Now, I know we all say we're going to do that, but it's very hard within the public sector, particularly when you look at the way the public sector has grown up, not just in Wales, but throughout the UK. And you look at the way that it's grown up, it's very hard to move outside of those silos unless there is some kind of overarching narrative or story, and Healthy Cities provides that narrative or story.
Okay, great. Thank you very much.
Okay, thank you very much.